If you have ever met someone who has received an organ transplant or has an autoimmune disease like rheumatoid arthritis, most likely they take immunosuppressants. Let's take a look at what immunosuppressants are. Immunosuppressants are drugs that work to suppress the immune system.
While there are many examples of immunosuppressants, they can be split down into four main categories. And these are corticosteroids, which slow down your whole immune system, inhibitors, which reduce the effectiveness of particular immune cells, immunomodulators, which prevent T cells or lymphocytes from working, and some biologics/biosimilars, which help lower inflammation. There are two main reasons why someone would take immunosuppressants. The first reason is to prevent rejection of an organ after a transplant. When you introduce foreign tissue into the body, like you do in a transplant, the immune system often recognizes it as a danger and attacks it. Immunosuppressants can be used in this case to prevent this from happening. The second reason is to treat an autoimmune disease. Autoimmune diseases are a result of the immune system attacking the body's own organs, tissues, and cells. Immunosuppressants can reduce the strength of the immune system to prevent it from doing this. However, while immunosuppressants can be a good treatment in both of these situations, by reducing immune response they cause the patient to be something called immunocompromised or have a weakened immune system. As a result, people who take immunosuppressants can be at a higher risk of infection. Due to having a weakened immune system or being immunocompromised, those who are taking immunosuppressants have an increased susceptibility to pathogenic and opportunistic organisms. For patients who are receiving an organ transplant, taking immunosuppressants increases their risk of infection. People with autoimmune diseases taking immunosuppressants have also shown possible increased susceptibility to diseases. However, while this is generally true, it's actually not always the case. Take COVID, for example. While the CDC does classify those who are taking immunosuppressants as high risk, many studies have so far shown that overall, those who take immunosuppressants are not actually at a heightened risk of contracting the disease or having a severe infection. This data is actually consistent with that from the SARS and MERS outbreaks, which were both coronaviruses as well. While this data probably seems strange, scientists say that it may not actually be that surprising. This is because the dangerous respiratory symptoms associated with coronavirus are likely exacerbated by an overreaction of the immune system consisting of excessive inflammatory and cytokine responses. This is actually what some immunosuppressants work to prevent, and because of this, there's actually some research being done into whether certain immunosuppressants could be used as treatment for COVID in these types of cases.